Getting through our content today. But we're so excited to have you guys. Welcome. My name is Savannah Barrett, and we're going to be talking about regeneration in practice today, a clinical conversation with the fabulous Dr. Lisa Pruett. So thank you guys so much for joining. We are recording this, so you can go back and rewatch anytime. But as I said, please pop your questions in the chat. We'll answer them as we go. Oh, hi. Nice to see you guys. People taking notes. I love it. We love to see the AI action. But let's get into things. Misty's here from Oklahoma. We're happy to see her. Welcome, welcome. I see lots of hand raises. This is exciting. I think you might be trying to wave to us, but we're so glad that you guys are here. All right, let's get into our first slide as we kick off our webinar here this evening with Dr. Pruett. And I've got Shah in the chat moderating for us. She'll be able to answer any questions. She's also getting our slides rolling today, which is going to be great. So she is a member of our training team, and I am the Senior Director of Customer Success and Sales Enablement, which is a fancy way of saying that I oversee the post-sale team and also all of our clinical education. And I'm so privileged to be at Glow 2 Facial, where we've got fantastic technology to bring to you guys. And more exciting than that, we've got fantastic providers to talk to you about it. And I'm joined here today by Dr. Lisa Pruett. If you're not already, please make sure you follow her on Instagram. She is at Dallas Derm, and she is really one of the best in the business. As she likes to say, she is a down in the trenches dermatologist. She does not mess around. Her patients love her. She's got thousands of patients with a very long waiting list. And so we really appreciate your time with us today, Dr. Lisa. Would you mind saying a quick hello to the crowd? Give them a
Sure.
little bit of your background, anything I might have missed.
Yes. Hi, everybody. I'm Lisa Pruett. I am a practicing dermatologist. I've been a dermatologist for about 20 years now. Can't believe that. I practice with my husband in Dallas. We own our own practice. It's called Revival Dermatology. We have three full-time dermatologists and three estheticians. So we have a very comprehensive practice of medical and cosmetic dermatology. So I'm excited to talk about the Glow 2 facial. I've had it in my practice for almost 5 years now. So yeah, I'm excited to be here. Thank you.
Well, we're so glad to have you. And, one of the things that I know we've talked about standing out for you is the regenerative aspect of Glow 2 Facial, which is, of course, our theme for today. But when we look at the next slide and you start to think about what really is regenerative aesthetics, we hear this buzz a lot. And what does it mean? So I'll share with you guys what our definition is and where the inspiration for that came with on our next slide. So when we think about regenerative aesthetics, I think the easiest way to think about this is it's an approach that happens within your body rather than against it. So we're essentially just leveraging our body's own natural biological processes to heal and strengthen and regenerate the tissue. And what's fantastic about this is not only is that a huge part of our platform and ethos, but we're seeing this all throughout the industry. MERS Aesthetics actually does quite a lot of broad study on this, and 79% of consumers in their survey said they're really just looking for treatments that enhance their natural features rather than alter their appearance. And we'll talk about that a little today, but if you're joining us from anywhere in the country, I'm sure you're seeing that trend as well too. People are coming in less and less with pictures of celebrities that they want to look like, and they're coming in more and more with a picture of themselves from 10 years ago and say, I just want to look like I had a great night's sleep. And that is the heart of regenerative aesthetics, is using your own natural abilities to look and feel as healthy on the outside, as youthful as you do on the inside. So it's a great topic for us. And the way that it fits into the Glow 2 facial protocol, we actually have 4 steps. So if you're using the treatment, this is a great time to refresh on how we're positioning this to our customers. But if you aren't yet, I hope this stands out to you as such a new way for us to bring a very results-driven, but still relaxing experience to customers. So the Glow 2 Facial is a 4-step multimodality experience, and we begin with Radio Frequency Pro. This is what helps to restore the firmness. So we're using that radio frequency technology to target the dermal level of the skin, building all of that collagen, elastin, hyaluronic acid. And this is what gives that kind of lift and firm feeling and really makes the skin look youthful and resilient. But just like, cranking the engine on the car and warming things up, you got to have a full tank of gasoline if you want it to go anywhere. And I always like to say that's what our exfoliation step does. It is what powers the cell to really be functional at such a high level. And you're probably thinking, are we putting oxygen in the skin? What are we doing? No, we're actually using a CO2 rich environment on the skin surface to trigger something called the Bohr effect. But the reason that's important is this step not only is the one that really feels like something is working, it is like this refreshing mask of bubbles, but it creates a surge of oxygen from the bloodstream and redirects that, or from the bloodstream and redirects it up to the surface of the skin. And that ultimately creates the ideal conditions for the skin to be very nourished, for it to be able to absorb actives more effectively, and for it to have that cellular power and regeneration that's coming into play with the radio frequency and the other compounding steps. We couple this with our third step, which is ultrasound technology. And I love this. This feels like a hot stone massage, is what most of our customers will tell us. And we're using those ultrasound waves to essentially create micro vibrations in the skin. And this instantly not only soothes the skin, but it enhances the permeability of our protective layer. And this way, we're able to pair it with all of our active serums. The skin really soaks everything up, and this is what I say, it always gives you like that Instagram filter effect to the treatment. You just look glowy and dewy and very healthy and revitalized after the ultrasound step. We finish with detox, which is a two-in-one step. So we're not only working on lymphatic drainage, but we are also bringing fresh blood supply with therapeutic massage. And so it's hands-free, it's very easy to perform. And not only does it feel wonderful to finish the treatment, but it's purposeful in that we're reducing that redness, we're reducing puffiness, we're freshly supplying oxygenated blood, I should say, into an area that is very active during the treatment. And so it's a great way to put a bookend on a completely regenerative experience that helps the skin to just work better from the inside out. And I can't wait to talk to you, Lisa, a little bit more about your experience with it. So, as we think about, how does Glow 2 Facial fit into your practice and regenerative aesthetics and all of this, we're seeing this become a real category shift, especially with dermatologists, which I think is exciting. They're thinking a lot more about skin health. And so, from your clinical perspective,
Yeah.
what do you think is driving that shift? What does regeneration really mean? And what's driving us more towards this now?
Yeah. I mean, regeneration, in my mind means that we're just trying to restore, we're trying to turn back the clock. I mean, we're trying to restore how our skin functioned when we were, when we were younger, when we were, when our skin was more vibrant and we were making all the collagen and elastin that, I mean, you look at, children's faces and just how perfect their skin is. The whole like premise to like cosmetic dermatology is trying to reverse the clock. And so, a lot of what's been done in the last decade, 15 years, 20 years, when I started my training, that was the very beginning of filler. And so I think, we were trying to mask a lot of the aging with things like injectables and, there is a place for all of that, but, things that are more natural, things that we can do that are going to help you build your own collagen, restore your collagen back, are just going to be, I think, have a better longevity. Just patients are going to come back for those kinds of treatments. They're going to like how they age. So, regenerative medicine is really buzzy right now, but, it's really what we've been trying to do. And just that, the science is just getting better and better. We still have to be, cautious in what we're choosing to bring into our office. But, things are really growing really fast in this
They
space.
are.
Yeah.
You used a word that I love of we were masking the aging. And I think that's such a great description because I think a big reason we're seeing that shift is ultimately, if you mask it enough, you start to not look like yourself, right? It literally
Yeah.
is a mask, and you have filler laying on your skin rather than your skin looking vibrant from the
Right.
inside out. And I think that's
Yeah.
something that, you've really captured well. With there being so much noise in the space currently, how do you separate treatments that genuinely are regenerative from ones that are kind of just using the language and getting on the train for the hype?
Yeah. Well, I mean, I think you just have to look at the science of the treatments and the products. If there are, obviously, if there's studies to back up the science, I mean, that's great. I mean, that's, even better. A lot of these newer treatments, though, I mean, we have to understand what the treatments are doing, and then treat our patients with these things and learn more, in the day to day following these patients, month by year to see what treatments are the patients coming back for, what are they wanting again and again, and what are we seeing. So it's hard. I mean, there's so many things to choose from. There's new things all the time. It's a constant, and that's, I think, why I really liked the cosmetic. I mean, I love all of dermatology, but I love the cosmetic part because it's just always changing and there's just so much to keep learning about.
You were talking a little bit about what are patients really asking for and staying in
Mhm.
tune with them.
Yeah.
What are the biggest trends that you're seeing? Is there anything that they're coming in and asking for by name or they want your input on? And have you seen that change,
Yeah.
in the
I mean,
landscape of the last couple of years?
I have patients come in for, cosmetic consultations, and most of what they're saying is that I want to, I don't want to look different, than myself. I want to help the aging of myself, but I don't, everyone is scared to look weird.
Yeah.
Everyone is scared of looking, overdone. So if you just start with the skin, I mean, the skin is the starting point. And that's where I think Glow 2 Facial and these really, no downtime treatments fit well because patients will do non-invasive, no downtime treatments so much more than they will sign up to do, treatments like lasers and, things that have downtime. So, I think it's important if you're going to have a practice where you want to have all the things to make sure you don't forget about the treatments that patients really do like. They like what they're doing for their skin because they keep coming back for more. When I was in training, I mean, we weren't learning about facials. This wasn't something that, when I was in training, like something that I thought would be, part of the menu of things that I would be offering to my patients. But it does have a place. And, if patients are, they like how their skin does, with facials and, with the Glow 2, it's just more than, your typical facial because we are doing things to the skin to help, oxygen, that the first step of oxygen, well, before RF, became, and added on, treatment, which I really love that y'all did that. But the oxygenation step, just, there's nothing like that that's going to help, improve the oxygenation of the tissue so that it's going to perform better. There's just so many steps to it that I really liked when I initially kind of started looking at what devices I wanted to have.
We say properly oxygenated tissue responds better to anything else that we're doing to it.
Yeah.
And I think Glow 2 Facial fits in this space so well because it's not only the gateway for a lot of people, like you said, that might be nervous, they're not
Mhm.
sure where to start in this journey, but it's also the foundation. Having that oxygen rich, healthy tissue, healthy skin, it is the baseline and it can even make other treatments more tolerable, less scary, less downtime, like easier recovery. I mean,
Mhm.
we put people in hyperbaric chambers all the time
Right.
after surgeries for recovery improvement and things. So I think when patients really feel like what they're doing is not just outcome driven, they always want it to be outcome driven,
Mhm.
but it is cumulative. it's long lasting, it's relaxing, it's comfortable to
Mhm.
receive. When they see that package all come together in one, I think it really helps them. To your point, this is not facials from the 80s, right? This is
Right.
not like in a back
Yeah.
room with essential
Yeah.
oils. And not that I don't like essential oils, but there's a
Yeah.
lot more magic in what we're doing now in multimodality and regenerative driven experiences. So I'm glad
Yeah.
that your patients have been more open to that.
Yes.
You were talking a little bit about what interested you initially and how you kind of first found it. Was there a wow factor? Was it the oxygenation for you when you first experienced the service?
Yes. I mean, so prior to Glow 2, I had another device. And when I demoed the Glow 2, it just was so different, and I mean, I personally loved how my skin looked afterwards. There was more of a wow factor. And I really do think that it is that oxygenation step that oxygen in our tissue is just, we just know that it is. I mean, there's science to back up that your fibroblasts are going to be building more collagen. Um, it decreases inflammation. And also it like reduces microbes. So, I mean, I think, especially for people that have acne, or just inflamed reactive skin, I think it's really good to oxygenate your skin. Um, so, yes, it was a wow factor for many different
Like I said,
ways.
it's the science behind it, knowing that it works. But I think what's important is it's not complicated science. It's really
Yeah,
like
no.
common sense science. And I think that that helps consumers and patients
Hmm.
as well, because when I tell them, I'm like, look, let's make this really simple. What's the thing you can live the least amount of time without? Like it's oxygen, right? You can go a couple of weeks
Yeah.
without food if you're on an island, or you can go a couple of days without water, but oxygen, we've got minutes. And obviously, if we think back to good old cell biology from the olden days, like mitochondria is the powerhouse of the cell, but it's really oxygen. I mean, right? We all love that, but
Yeah.
it's oxygen. It is
Yeah.
what everything has to have in order to be functional. All of these productive cycles, making collagen, making elastogen, even having the energy to differentiate these cellular processes is oxygen dependent. And so I think that's something that clicks with people really quickly. They're like, oh,
Mhm.
yeah, you're right. And what a lot of people don't realize is that the skin is the most asphyxiated organ that we have, right? It's going to the lungs and the
True.
heart and the brain and everywhere else.
Yeah.
And so when they're not redirecting that excess oxygen, the body, it gets lazy as we get older. And
Mhm.
so I think that's why we see regeneration as such a valuable approach now. Are you, what kind of results are you typically seeing? You know, we're kind of describing the scientific side of it, but
Mhm.
what kind of results do you see in your practice? What's the time frame? What's the feedback that you get from patients
Yeah.
about the service?
So, I mean, I have different types of patients that are coming in for Glow 2 facials. I have some patients that, it is a monthly thing that they're doing. I mean, and for years, they've been coming in every month and getting the Glow 2 facial. And they just love how, it's become a routine for them. And they just love how their skin is, when they do these treatments. And then, you can also use Glow 2 to prep, for different treatments. Like, if you're prepping for a laser resurfacing treatment, I do think that your skin is going to react, in a more favorable way and heal better if you kind of prepped it with this, kind of Glow 2 oxygenation and getting it really hydrated, because we know lasers, the resurfacing ones are looking for the water in our skin. So
Hydration, yep.
yeah, so I think, prepping with a Glow 2 facial, a week or so prior to laser resurfacing, is going to really help, improve the outcome and the recovery time also.
Well, speaking of combinations and prep and all these different things, how else does Glow 2 Facial fit in on your broader menu? Do you only do it standalone? It sounds like you're using it in concert to prepare
Yeah, I mean,
skin. Do you use it
it is
afterwards? What else do you do?
it's a standalone item on our menu. And some patients just use it as a standalone prior to events where they're prepping for a wedding, 6 months from now. Some people are doing it on as a regular routine. Some of them are doing it in conjunction with, some of the laser or downtime procedures that we have. It's kind of a mix. I like it that way. I don't want everything is very customizable, in our practice, just like, you can pick what pods you use. And so I don't like to have everyone does this approach, because everyone is going to be just everyone is different. And so, I think it fits well in a lot of different ways. And I have three estheticians that are doing doing the service on patients. Um, and so, they may have patients that they're doing their monthly facials and then talking to them about other treatments. It can be a gateway also to more invasive treatments in the office. Um, and so it's been really great for our practice.
Well, I'm glad to hear you say that. And, in talking to other practitioners, sometimes I'll get asked, questions like, well, my patients aren't really coming in and asking for a glow 2 facial, so why would
Yeah.
I offer it? But I think the reality is they trust you first, right? It's kind of your
Mhm.
role to bring innovation to your patients. How do you introduce them to something that you're excited about from like the science perspective? Maybe it's not, Botox, a name that they really know, but how do you
Yeah.
get them excited about the results that they're going to be able to receive?
Yeah. Well, we recently actually did one of these virtual events,
Oh, yeah.
which was really I've done this kind of event for some other, more invasive procedures, and it's worked well. And I was really like very happy with the turnout that we had for that. So that was a nice way to kind of introduce the Glow 2 to our office. We do different events. We do lunch and learn events. We have a yearly like annual event where there's specials and they can come, patients can come and learn and talk to our different reps about treatments, and that has really worked well. I also, I think it's important to we have a consultation that patients do, and we have a menu of items that I'm circling and giving them all the information. So I just, I like to a little bit over educate patients probably. And I'm not somebody that's telling them you should do this, this, and this, but I like to give them a lot of options. Um, so, Glow 2 Facial is on our menu of resurfacing and rejuvenating, items. And that also is going to include things like lasers um, and microneedling and things like that.
Yeah, so many access points. And you were mentioning earlier seeing people do really well with this that have acne because of the oxygenation and the microbial components.
Yeah.
Who else do you see have a particularly good outcome with Glow 2 Facial? Any specific concerns
Yeah.
or
I
skin
mean, I
types that you
think
see do great?
definitely people that have, people that may not be doing their routine regularly. I think it's really great for people that are, kind of wanting us to do the work for them. So I think it definitely will, fits well in that group. Um, it fits well with everyone. There really isn't, with acne patients, with patients that
Um,
have really dehydrated skin, those patients get really amazing results because when you can really oxygenate like this dehydrated, sun damaged skin and they leave and their skin is so just refreshed and rejuvenated, and they just love how their skin looks and feels afterwards. I don't know, it hits so many points. It's hard to like really put it in one category.
It is hard to put it in a box. And that's why I tell
Yeah.
people, you've got the freedom to take it out of the box. You don't even have to do just the Glow 2 as a standalone. I mean, we see so many
Right.
people incorporate and the oxygenation is what makes it, go viral on social. Everyone sees the
Mhm.
bubble and they love all that. But there's so many other pieces, right? You have radio frequency that's highly tolerable and feels
Yes.
relaxing and it's not painful. And so that, that's a great first
Right.
experience to get people in. And ultrasound in and of itself, right? Before you get
Hmm.
someone maybe into soft wave or something else, these
Yeah.
are just great
Right.
tools to introduce
I
foundational skin
totally
needs.
agree. And the fact that that you brought on the RF Pro, which is really great because I mean, I've been using radio frequency in my practice for many, many years with the RF microneedling, and now we
Yeah.
have another RF device. But glow to it, having the RF as an option is I think again another nice foundation and gateway to other things in the practice. And patients are learning more, and I mean, there's just so much information out there for them to learn. And the fact that you can get some of that radio frequency energy in a facial to help kind of energize your fibroblasts. I mean, I think doing that also is going to just make other treatments down the line, even better.
I like to say that Glow 2 Facial is like a shot of espresso for the skin. It just helps it wake up and start to
Yeah,
behave more usefully. And just like warming up before the gym, we use a lot of like athletic
right.
comparisons at times, but it helps to really train the skin how to behave and respond properly when you do introduce slightly more invasive or more powerful modalities to the skin.
Yeah.
Would you say, Lisa, if a provider were to ask you, like, "Ugh, I just don't really know if a facial treatment is going to fit into a clinical practice," what would be the advice you'd give them or the feedback that you would say after you've experienced Glow 2 Facial?
Yeah. I mean, I would say, you know, I totally understand where they're coming from, but it does fit because I have seen it fit. I've had, my husband and I opened our practice 5 years ago. We opened with, the Glow 2 facial. And I mean, patients want it. They are going to come, they're going to go somewhere to get a facial. And why not give them, just like an expanded, type of facial that has a lot of really great science behind it. I mean, it fits. Patients want it, and I mean, I mean, to be honest, as a coming in as a dermatologist, I was kind of shocked that there were
Right.
so many people that wanted Glow 2 facials, but I experienced it myself. I mean, I know how great your skin looks after, but I mean, they really, it's a great part of the practice. And we do really invasive, deep laser resurfacing and microcoring. I mean, we're doing a lot of invasive things in our office. But patients want things that aren't going to give them downtime. And so it does give
And
them an option, for if you have a patient that doesn't want downtime, you know, this is something that they can do that's going to improve their skin, improve the health of their skin, and they're going to like how their skin looks and feels.
yeah, and it's interesting when you say that because I know you have a massive waiting list for customers and a very, very large database. But
Mm,
I think that also comes from not are you only are you offering them so many options for treatment, but they want the relationship with you. They trust you. And I find that that's
mhm.
true whenever whoever is talking about their book of patients, they're coming to
Right,
you because they love you and they trust you. And maybe you should offer them a facial option because they're going to trust your facial option more than somebody else's facial option. And
right.
that's a great reason to have it also is fill every gap for your patients because they ultimately are coming for you, not just for the microcoring or just for a low T
Right, right.
facial. They
Yeah.
love you. And I think that's something you guys have done a great job of differentiating yourselves with
Yeah.
is that kind of patient-centered care.
Yes. Yeah. I mean, I think a very comprehensive menu is great, but if you're just starting out, you don't need to start with a really, I mean, I think Glow 2 Facial is a great starting point. And then see what your patients are wanting more of. Are they wanting more of the RF type tightening? Are they wanting more, infusion of products and, talking about injectables, but it's a good kind of gateway, I think, to other things also.
That's a very wide net.
Yeah.
And you have talked about you've had your practice for 5 years, you've been in dermatology. I know it
Mhm.
starts to get scary when we say 20 years, but thanks to
Oh,
all
I
the
know.
regenerative stuff, we can say it. We've
Yeah.
been around for a while. But
Hmm.
in the course of your career, how has this kind of shift towards away from masking, more towards natural? How does that change how you build protocols? You talked about being very customized for your patients. Like, how do
Hmm.
you approach building a new protocol
Yeah.
in your career versus maybe 10 years ago?
I mean, my goal is always to try to improve their skin without having to add things to it that are not their own. So, when we're talking about injectables now, I mean, there's some things that that just are not you can't regenerate to make your muscles not wrinkle. But when we're talking about other things like injectables, um, I've always been more of a biostimulator injector than the other, hyaluronic acid. So a lot of my patients, kind of they know that, and so they're more willing to do things that they know that I'm doing something that their body is going to be kind of doing the heavy lifting. So the non-invasive, like protocols and the regenerative protocols are, I mean, that's just the foundation of dermatology. When we're talking about like the invasive things like lasers and resurfacing and microcoring, I mean, these are all things that we're doing something to the skin to create a wound so your skin can regenerate. So all of these things are creating some kind of regeneration. So, I mean, to be honest, my approach hasn't changed that much because I never really, I wasn't someone that was telling patients they needed 6 syringes of filler to look better.
Yeah.
Um,
Well, and I always tell providers that Glow 2 Facial is for the thinking practitioner. If you really know skin, you understand mechanics of aging, you really care about curated approaches to each patient
mhm,
because they all have different preferences. They all have, they're coming in at different baselines. They all have different budgets and timelines and everything. And
mhm,
so if you really listen to the patient, the protocol builds itself if you know. See, and that's why I say, like, we even use the modalities on their own a lot of times. Like you were talking about laser. I love using our ultrasound with our hydrating serum right before laser because it helps attract that water to the surface. You get a
mhm.
beautiful fill from the laser at that point. So there's ways you can be really creative with your protocol, even with the same set of modalities or tools in your toolbox that you've always had.
Yeah,
And I think that's something that you guys have done a good job with is really not being afraid to try things and incorporate natural mechanisms to give natural results.
yeah. And also too, I mean, talking about regenerative things, and talking about topical products. I mean, obviously the ultimate initial regenerator was tretinoin, was Retin-A, right?
Exactly.
Uh,
Yeah.
and so now we have so many more options. I mean, we have growth factors have been around for a long time, peptides have been around for a long time, and now we have exosomes and, you know,
Yes.
human-based versus plant-based, and all of these things we're just trying to signal the skin to do what we want it to do. And so I love that y'all brought on kind of the plant-based exosome into the new exofirm, because I think it's, we're getting more tools in our toolbox to help regenerate the skin it's not only tretinoin that we have topically to do that.
Yeah, and I love that you describe it like that because it's so true. And people will ask me, like, well, which should I have? Should I do this or that? And I'm like, you should do it all. You should
Hmm.
do everything. Nobody just uses a hammer to, do a home reno. You need everything. You need
Yeah.
screwdrivers and, wrenches and all kinds of things. And that's why when you start to layer, that's how you get those compounding results, those exponential changes in the skin is when you're doing a laser series plus Glow 2 Facial, plus you're using plant-based exosome and they have growth factors at home and they're on Tret. It's that compounding that really makes a huge difference. I'm glad to hear you've had a good experience with Exofirm. It is my new favorite for sure. I'm interested to hear a little bit more, Lisa, about how do you set expectations for patients, especially if we have very educated patients now, typically they're coming in, they've kind of done research. How do you set expectations for outcomes with treatments?
Well, I mean, so in my practice, I gather before and after photos of patients that let me share photos in the office. And so, I mean, the outcomes are, I like to show before and afters. Uh, so if we have a patient that's getting a they're interested in a laser procedure, I have before and afters that I show this is what we've done for these patients, so they have a better idea. Because I do think, I mean, it's a little bit hard with Glow 2 facial. I mean, everyone looks great afterwards, you know. So I'm not really showing them before and afters of a Glow 2 facial, but all of, the other more invasive things, I think it's important to have patients see what you're doing in practice. So that's been very helpful.
And I think a lot of times just being a believer of, or, a sampler of your own product, if you
Oh,
will,
yeah.
right? Being a believer in what you have, they really do trust you. And that's what we see is 80% of patients are actually expecting their provider to be the one to tell them what they should be doing. Most of them they're like, I read about this, I think that, but they
Mhm.
want you to make it for them. And
Yeah.
I think that allows you the opportunity to set those expectations of, not everything is a facelift, but there are ways that we can absolutely make you look refreshed and restored and rested and
Mhm.
youthful.
Yeah.
I want you to talk a little bit more as well, Dr. Lisa, about your sequencing of things. So one question we
Mhm.
get all the time is how do you mix with injectables, with laser, with other modalities? In your opinion, is there an order of operations that matters with multiple modality approaches?
Well, I- there's so many different ways that you can do it.
Yeah.
So I'm
It's for the thinking practitioner.
I guess it is. I mean, we don't have a certain protocol. I mean, every patient is going to be different. And so I may have patients that I'm talking about prepping with Glow 2 facial before we're doing a series of lasers. I may have patients we're just talking about doing Glow 2 facials before their wedding and as far as, doing it with injectables, and I mean, I have patients that are doing all of these things, and we're just making sure, if they're getting their Glow 2 and they're getting Botox on the same day, they get their Glow 2 first, and then they come see me right after. Um, but it's a more like curated, I don't have honestly certain protocols, but I just think it all works in different ways. And you got to look at the patient, what their skin is telling you.
It's one of the hardest questions for us to answer clinically as well, as everyone wants a step-by-step protocol. And I'm so I'm
Right.
like, you've got to know the skin and you've got to know the modality, which I will tell for those of you that are on here, if you haven't been in the app, we'll have Shalia put the link in the chat for you guys. But we actually have a combination therapy guideline. So it will give you the guidelines on how you can mix with any type of modality. But to your point, I always go back to my little statement of properly oxygenated tissue responds better to anything that you do to it. And so, like you said, injectables, right, are going to lay better in properly oxygenated and hydrated tissue. You're going to have less potential for bruising, right, if you're able to properly oxygenate beforehand and reduce inflammation.
Yeah.
So, no matter if it's prep, correction, recovery, maintenance,
Right.
it is always beneficial to have some component of the treatment involved in there. And then it just becomes
Right.
fun. You get to be a chemist and mix it
Right,
and match it
exactly. And
yourself.
yeah, I mean, and it's kind of, I mean, you can't really mess it up, before,
No, no.
after, as long as you're doing it somewhere in there. Yeah.
Yeah. Just, watch for the barrier and you're going to be okay. This
Right.
is where, like you said, it's fun. Not only can you customize with the steps and things like that, but you can customize with the actual serums and ingredients and mix and match there too. So
Right. Totally.
endless fun.
Yeah. For
Endless
sure.
fun. When we look at kind of the bigger picture of things, though,
Mhm.
where do you see regenerative aesthetics going in the next 3 to 5 years? We've kind of talked about like how far we've come, but what do you think is on the horizon that people should be thinking about today?
Well, I mean, I think there's going to be, I mean, more and more, hopefully, good science-backed evidence behind some of these regenerative ingredients. Maybe I don't know if we're going to be getting to inject things or not that we can't do yet in the US. I think there's going to be more science to back up everything that people are kind of playing with right now. In the regenerative, we're talking about, the PDRN products and the
Yeah,
PRP and
polynucleotide and yeah.
the exosomes and all of that. And I think that we're going to just have more and more science to show us you know, how great wounding the skin can be for like regeneration. And like
Exactly.
as far as like
Exactly.
making your skin healthier, making it perform better, getting less skin cancer, all those things.
Well, and I hope that I'm already seeing this trend, and I hope that we continue to go towards the industry being a lot more accessible at any age. That you're not too late, you're not too
Right.
young to
Yeah.
collagen bank, you're not too old to start if you never had a facial and it's your 70th birthday. All of that's okay. There's something for everyone. And I think creating an industry that's a lot more approachable is on the horizon. And to your point about the science, I continue to see a closer and a closer and a closer blend of like the beauty world and the medical world. Really, it's a whole wellness approach. People are caring about the inside and the outside all at the same time. And the skin is an organ. And I think it's starting to kind of
It
get
is.
treated a little bit more seriously, which is a great thing to see.
Yeah.
With all the experience that you've had,
Hmm.
if you were to tell a provider anything about building a regeneration approach in their practice, what would be like your one piece of advice provider to provider?
Well,
Besides get the glow 2 facial,
right.
obviously.
Yes. No, I mean, I think it is really think about what kind of menu of items you want to have for your patients. And I think you have to have some non-invasive things in that menu. You have to have things that have no downtime. You have to have things that are that patients are going to want to come back for over and over again. And I think, like I said, I think Glow 2 Facial is really like it can be a gateway to so many other things, but it really kind of lays a good solid foundation for, just better performing skin. And if that's just doing facials, then that's just doing facials, or if it's getting your patients to do other treatments. But regenerative like cosmetic aesthetic treatments are really they're just the foundation for what cosmetically we're trying to do. We're just trying to reverse the aging of our skin, be it getting rid of spots on the skin, improving collagen and the density of your skin so it's not lax and wrinkled. But regenerative medicine, even though it's very buzzy and it's a big buzzword right now. I mean, it really is what we've been doing. We're just getting better and better at it.
It's such a great way to describe it. And for my gang that's here live with us, I'll open it up here to questions if you want to start popping them in the chat. I'm sure you guys want to ask Dr. Pruitt a couple of things, but as I give people a chance to do that, I always go back to very similar to what you were saying of asking providers, like, what do you want to be known for? Because that's really the best way to determine what you want on your menu. And and it's not just what do you want to be known for from outcomes, but like how do you want to be described by your patients when a friend asks them who they go to? Because most of them, I think, will see there's a natural regeneration approach built into that. Because usually you get some kind of response if you just want your patients to feel great about themselves, or whatever your ethos may be. But there's so many ways for us to see, like you said, the science really come to life and back up the vision that we've had for a long time have just not always maybe had the tools to deliver on and
Hmm.
execute. So um I do see some questions coming in, and one that I'll ask you, Dr. Pruitt, is are there any incentives or discounts or ways that you pair the Glow 2 with other procedures?
No, I don't. No, I don't. I mean, we have a certain price for the Glow 2 facial. We're not really bundling. Um, Everything is just kind of as it is. We do specials like I do think that there is something to having lunch and learns about about products and kind of blending things together. But no, I'm not doing that.
And I think good for you, right? Because I almost think of like a complimentary consultation is a discount. That is an incentive. Just the time that they're getting for you to put a package together for them is a
Mhm.
huge incentive. You can you talk a little bit about how did you build such a large patient base in a short period of time? What were some of the just business tools that you used to set yourself apart?
Hmm. I just part of me thinks if you know, like the saying, if you build it, they will come. I don't know. I, it just happens. I mean, I just think if you take care of patients and they're happy with, what you're doing for them, they're gonna just tell their friends and their family members, and you're gonna just have more and more patients come see you. Um, I mean, I think word of mouth marketing is the best. Um, I mean, you can do, social media is great. But I think that the word of mouth is really where, the best, because those are going to be patients that are, going to come back again and again, versus if someone just follows you on Instagram and wants to come and check you out and.
Yep. It's still to this day, and despite all the AI, and we all feel like we're social media creators and all this other stuff, 78% of new customer acquisition still comes from word of mouth. So it's
Wow.
by far still the most valuable way to get people in there. And it's like you said, it's just to give them a great experience. And I think the Glow 2 really does that.
Yeah.
I'd be interested to know from you personally, when you receive
Mhm.
the treatment, what is your favorite step and why?
Oh gosh, I like all of them.
I know.
Uh, I think my favorite step is probably the oxygenation. I mean, that's my favorite.
It's hard to not be impressed by that. We always call that the wow factor. They're like,
Yeah, but
whoa.
honestly, I will say sometimes I do it I give myself a glow facial if I don't have anyone to do it for me. But I will say that like when one of my estheticians will do it for me, the last step is also pretty nice.
Yeah, it
It
is
feels
nice
different
when
when
you get the
someone else
massage
is doing
done.
that for you. Yeah.
Yeah. You mentioned that you have three estheticians, you're managing other providers as well. We always get questions about like, hey, am I allowed to do this? Am I not allowed to do these things? How do you guys handle when you're bringing in like more invasive equipment or larger technology or just all the different spread of offerings that you have? How do you guys make sure that you're compliant but still giving your estheticians lots of opportunities? Is there a way that
Right.
you really help them build their confidence?
Well, I mean, I think our practice is different. I mean, I'm very hands-on with the estheticians. My desk is literally right near theirs. I mean, I know everything that's going on, so I'm very hands-on with them. But also they, as I mean, they we do. I mean, there's a lot of training that goes in the beginning, and then I mean, they're just getting more and more experience with, as the years go by. Um, in Texas, it's pretty, I mean, the laws are pretty lax, but I am very hands-on with them. There are certain things that I delegate to them that I feel comfortable delegating. Glow 2 facial is definitely something I'm delegating to them. And then there are things that only the dermatologists do in our office, such as injectables or deep lasers or microcoring. And vascular lasers. That's what, our derms are doing. But, I think they do such a good job. The treatments that they do such a good job. But they do go through, training and, we're always like talking about, settings and protocols and everything. But I'm very hands-on with them.
Yeah, that cross-pollination is huge. I'll do a final call for questions from our group. And one other thing I'll ask you, Lisa, is how do you guys build a healthy ecosystem like that? Because I know there are a lot of practices that the esthetician and the doctor, they never talk, or there's really a lot of times modalities don't take off because they're not cross promoting to their customers. You're talking about injectables. Estee's talking about Glow 2 Facial, but neither is talking about both. How have you guys built a healthy ecosystem to ensure patients hear about every opportunity in your business?
Well, I mean, we have a consultation. Well, so in my practice, patients can schedule cosmetic consultations with me, and I charge a fee, so that I charge $250 for that. But or they can meet, or they can have a consultation with the esthetician. They meet with them. It's $50, but that goes towards like a product or something. Um, and so we have these, like, these forms that I've created that have all of the menu of our items. And we, if I have a cosmetic consultation with a patient, I'm writing all the things that we're talking about. We put that in our electronic medical record. So when a patient comes to see them and they've scheduled for some, they already kind of know what we've talked about. So that's a way that we kind of communicate with each other, is kind of through our consultation cards. Um, as far as like what things are going to take off. I mean, the things that take off are the things, number one, that they're going to be excited to do, and that their patients are going to like. So, I mean, I think that it's just sort of self-selects for what's going to be popular is what should be popular because it's a good treatment.
Yeah, it really is true. And there's so many ways that we can incorporate this. And I think, just the fact that you're starting that education, starting that conversation early. It's, I think, 7 touch points, right? Before somebody, from the first time someone hears about it to when they actually make a decision to purchase it. And giving them so many opportunities is a great way to feel low pressure, educational, but really make sure it's the right choice for them. That's great.
Yeah.
So I always have to end on my favorite question. And, we've added lots of new things. We've got a huge portfolio, but what is your favorite customization to use?
Well, I mean, definitely the new one, the Exofirm is going to be my favorite, for
It's
sure.
hard to beat. It
Yeah,
really is. We all said that too. We were like, we might be biased,
I
but
know.
as soon as it came out, we all were kind of like, is this our new favorite, right? This was
Yeah,
everyone's favorite.
yeah,
It's really a game changer.
it's
Yeah.
great. But I also like Hydrate. Um,
Classic. It smells wonderful.
yeah,
It's
yeah,
got great hydrating benefits. I always like to say that's like a good fishing lure to get people in because they look so dewy
yeah,
afterwards. It's like an instant filter. So,
yeah.
well, we love hearing from you, and I'm so glad that you've enjoyed Exofirm. For any of you that are in the chat, looking to get some product in your practices as well, we do have 25% off Firm and Detox right now on our website. And we've got some great deals on the radio frequency handpiece. So if you will, drop your name, your email if you'd like some more information, and we'll make sure we get you connected with your local rep. But for now, I just want to say, Dr. Pruett, thank you so much for your time today. It was such a pleasure to have you on. Anything else you'd like to leave the
Yeah.
audience with final words on?
Oh, um, just if you have Glow 2 Facial, or if you don't, you should really kind of consider using it more and having it in your practice, because it is really a great just foundation for that regenerative approach.
And we've got so many tools besides just the wonderful device itself. If you're not already in the app, drop your name and we will send you guys information to get in the app where you can find not only this recording, but all of our other downloadable tools, our resources, our shop. And we'll be excited to see you guys all on our next webinar. Once again, I mean, 20 years in this industry, a phenomenal practice that you've built. If you're not following Lisa Pruett at Dallas Derm, make sure that you're doing it. Such a pleasure to have you on and such a great time talking to all of you here. Thanks so much for joining, and we'll see you on the next one. Bye.